supplemental spending bill that, according to news reports, does not include the Senate language that explicitly allowed President Obama to keep photos of detainee abuse during the Bush administration confidential. I want to thank my friend, the Republican leader from Kentucky, who has shown such impressive leadership on, as he describes, probably the most important issue domestic issue, certainly, that will be addressed by this Congress. I look forward to working with my colleagues over the next few weeks on legislation reforming our current health care systems. America are looking to Congress to enact health care legislation that provides all Americans affordable access to health insurance and the ability to choose the health insurance policy that fits each American's need. Just yesterday, it was reported that 62% of Americans support Congress enacting a major overhaul of the U.S. healthcare system, according to a Diego Hotline poll. I believe healthcare should be available to all and not limited to where you work or how much money you make. I believe any proposal must use competition to improve the quality, availability, and affordability of health insurance and match people's needs, lower prices, and promote portability. I believe American families, not Washington bureaucrats or insurance companies, should be in charge of any health care decision. But I don't believe that we need to expand government's bureaucracy or to control 1/6 of our economy to ensure the uninsured get health coverage. Nor do I believe that Americans should be asked to pay more in taxes to cover the costs of any comprehensive health care reform legislation. Last month, the Wall Street Journal stated, quote, "The Democrats need the money to finance $1.2 trillion or more for their new health insurance entitlement. A sampler of ideas end or limit the tax-exempt status of charitable hospitals or make college students in work-study programs subject to the payroll tax. Also targeted are medical residents, perhaps on the principle that they'll one day be rich doctors." I agree that any real health care reform proposal must address the tax treatment of employer-provided health benefits, but not in such a way that would force Americans to fork over more of their hard-earned money to the federal government, particularly during these difficult economic times. Today, individuals who receive health insurance through their employer are not taxed on their health care benefits, as we know. However, those who purchase coverage on their own don't receive such a tax break. That's unfair and regressive. It hits those who need this tax break the most, the self-employed or working poor whose employer does not offer health insurance coverage. To offset the taxable treatment of this income, I believe Americans should have funds returned to them to assist with the cost of acquiring health insurance. An approach like this treats individuals equally, in stark contrast to the system we currently have. Key to any proposal is policy that allows people to have accessible, affordable, and portable health insurance coverage. Policy should also address what I hear from Americans everywhere I go: choice. Americans want choice. They want choices of their doctor, their care, their coverage, and employment freedom. Freedom to seek employment that's not dependent on whether an employer provides insurance coverage or not. This is particularly important in today's difficult economic times when Americans are uncertain about whether they'll have a job tomorrow. Some, including the president, criticized this approach. However, the New York Times reported, quote, "The Obama administration is signaling to Congress that the president would support taxing some employee health benefits." While I appreciate the president and Democrats' new consideration of such a proposal, it's not acceptable to turn this into a tax and spend health care reform. Any new resources derived from changing the existing tax treatment of private health insurance should be devoted to a fairer and more efficient mechanism for Americans to acquire private insurance. The United States spends over $2.4 trillion on health care. Health insurance premiums continue to rise as employer-based family coverage has increased, and Medicare and Medicaid spent $818 billion in 2008 and are projected to reach $1.7 trillion by 2018. I also want to mention something that should trouble every American and every member of this chamber. Last week, I spoke about what the special interests were doing to derail a much-needed health reform dealing with prescription drugs, a reform that is very bipartisan, and any member in this chamber knows I'll work across the aisle on policies that are important to the American people. Health reform is one issue that fundamentally must be bipartisan. All Americans are affected by what we do here, so we should be working in a bipartisan manner. So it's with extreme regret that I read in roll call this morning about a meeting that the Democrats staff threatening Democratic lobbyists or the organizations they represent against meeting with Republicans, and that attending meetings with Republicans, quote, will be viewed as a hostile act, unquote. This is outrageous. I hope the article is inaccurate. I hope that the staff of the other side doesn't view health reform as a process that they control by threats and hostilities. I hope we're above that. Madam President, I ask unanimous consent that the roll call article this morning be included in the record at this time.
Without objection.
Now, Madam President, I'd like to say a few words, and I ask unanimous consent for 3 additional minutes.
Without objection.
Madam President, it appears the House Democrats, according to a roll call article this morning about the supplemental bill, and I ask unanimous consent, this morning's inter-party fights pervade agenda concerning the war supplemental bill be included in the record.
Without objection.
The war, and I quote from it, the war bill, which is swollen with items including a cash for clunkers and incentives, will eliminate Senate language explicitly allowing President Barack Obama to keep photos of detainee abuse during the Bush administration confidential. Madam President, the Graham-Lieberman amendment that would classify these photos was accepted by voice vote. In other words, any senator who wanted to object or vote against it could have called for it. Instead, it was unanimously adopted. Now, according to the roll call article that I just quoted, that provision will be removed from the emergency supplemental. And according to that article, quote, one senior Democratic aide said Lieberman and Graham's threat to hold up the supplemental indefinitely unless their provision was included was unlikely to last, and predicted that Defense Secretary Robert Gates would likely pressure the 2 defense hawks to relent so that funding for the war wouldn't run out. I think this Democratic aide highly underestimates Senator Lieberman, Senator Graham, and the rest of us. Madam President, I had a conversation with General Petraeus just day before yesterday, and I believe those conversations are confidential, and I asked his agreement, to quote from him, if these photos are released, it will harm the ability of the United States military to pursue our national security interest and could put American lives in danger. Now, that's a serious statement from the most respected military leader that this nation has. And I want to point out something very important. Today, the President of the United States could issue an executive order classifying those photos and not allowing them to be released. He could do it today. It's time for the President of the United States to stand up to the left wing of his party for the good of the national security of this nation. So, Madam President, I join others that if that supplemental comes over without the provision, which was adopted unanimously by the United States Senate, to make sure that those photos are not released because of the harm it would do to America's effort in combating radical Islamic extremism throughout the world and put the lives of the men and women who are serving in our military in greater danger. So I intend to join my friends Senator Lieberman and Senator Graham in doing everything we can to oppose such legislation. This war supplemental is intended to help us win this battle, war on terrorism, dare I say. It is supposed to help the men and women who are serving in Iraq and Afghanistan as they pursue an implacable and evil enemy and try to instill democracy and freedom in these countries. And if these photos are made public, it will harm their effort and put their lives in danger. Madam President, I urge my colleagues to join me in opposing a bill that would eliminate the provision that prevents these photos from being published. And I call on the President today to relieve this pressure and declare by executive order that these photos are classified and not to be released to the world's public. Madam President, I yield the floor. Madam President, I note the absence of a quorum.